Okay, so we are videoing a plasma pen treatment. So can you tell us a little bit about what you're doing?
So plasma pen treatment, we are using plasma energy to hit the dermis and cause production of collagen and elastin. And in this patient's case, she has a history of acne and acne scarring. So we're using the plasma energy to help stimulate collagen and elastin and resurface this area. This treatment has a little less downtime than the CO2 laser. It has more downtime than doing a microneedling. However, it's much stronger than microneedling. Not all patients are good candidates for this treatment, but
Who would not be a good candidate for it?
patients that have a darker skin type
Okay.
are usually not a great candidate for it. But we can always do free consultations and decide, what would be the best plan of action. So she is going to experience a little bit of crusting on her skin starting probably tomorrow. This will really show up tomorrow. It's probably going to take her 3 to 5 days to get rid of that crusting, and at least 3 to 6 months to get her final results. So she may want to repeat this treatment here again in 3 months or so, depending on her results. But she's young, so she's got quite a bit of collagen to reproduce, and I think she's going to get much better results than someone who were, say, 80. So I think she will do quite well with one treatment, but depending on acne scarring and how much of an improvement you want, it's going to depend. Sometimes one treatment, sometimes 3, sometimes 4 or 5. It also depends on how long the scars have been there, the health of the patient, those sorts of things. But this is equivalent to doing about 8 microneedling treatments.
Wow.
So even though there is a little bit more downtime, it's more aggressive, and it actually turns out being less time if you lump it together.
Now, with this same treatment, like let's say someone had fine lines and wrinkles in these, maybe not on their cheeks, but could you use this treatment for fine lines and wrinkles instead of microneedling?
Absolutely. And we would probably do a specific area. Say if it's crow's feet, we can do upper lids, we can do any area that has fine lines or wrinkles. We can definitely do and treat that specific area to help with fine lines and wrinkles. Yes, we can do lifting of the brows. We can help with jowls, sagging necks, you name it, we can do that.
Okay. And how does this treatment compare to the CO2 laser, which we also do in the office?
So the CO2 has a little bit more downtime than this treatment, and I think the CO2 is probably a stronger treatment. However, this yields pretty good results in comparison to the CO2, and most patients do quite well with the downtime with this versus the CO2. So it just depends.
And
Depends on your
price-wise,
downtime.
too, right? Isn't this a little less expensive than the
This
CO2?
is less expensive than the CO2. It's more expensive than needling, but it is less expensive than the CO2. And the CO2 is great for a lot of things, but for downtime, this particular treatment is very effective for little downtime.
And how's your pain, Nina? Is it,
I feel like zapping,
but it's bearable?
yeah, it's like little tingles.
Little tingles, so it's totally...
But she did have a topical numbing cream. For
Yes.
those watching the video, she is not doing this without anything. And then what's the aftercare gonna be? What is she gonna do at home when she gets done with this to take care of herself?
So she is going to be supplied with a gentle cleanser and a serum. And she's going to apply those two things twice a day until all of her crusting falls off. Once the crusting has fallen off, then she is going to go back to her regular regimen and wear sunscreen like it's her job. Sunscreen must be worn to prevent pigmentation problems. So that is definitely a must. It is not a treatment you want to do before going to the Caribbean. You definitely want to be out of the sun for a good solid 2 months.